Okay, this is
What is this?
Carolyn Faulkner.
Just recording it for the video.
It's recording. Carolyn Faulkner, she was a caregiver to her husband James, who passed away about
6 years ago.
6 years ago. And so Carolyn's been a longtime friend of NCAN, and she was on our advisory board, and then the Healing Net stole her. And so now she works for the Healing Net, and the Net community is so lucky to have her. If you get a chance, you could read her blog. It's a blog, right?
It's a blog.
It's a blog about being a caregiver, and you can see that on the healingnet.org, right?
Yep. That's it.
Healingnet.org. Okay, so as many of you know, I had spoken earlier. I was misdiagnosed for 7 years. I was diagnosed with ileum, and I did have surgery back in 2001. 6 months later, I had surgery again, because at the time when they did it, they did not take out my gallbladder. It is now protocol that when you have an ileum tumor, that they do take out your gallbladder. And then I had a surgery in 2019, which took out tumors in my liver, mesentery, all over. I do have carcinoid syndrome really, really bad. I was one of the people who had a doctor, Dr. Waltering, who did a lot of off-label treatments. And so I was treated with standostatin for many years, 8 years. I was on it for 10, but 12 years. But 8 of those years, I was getting 4 injections a month. I was getting 4 30 milligrams a month. Until the point where they couldn't inject me anymore because the needle actually was bouncing off my butt. And so Dr. Waltering thought outside the box with Tom O'Dorisio, and they put me on an insulin pump filled with octreotide. So I got a 24-hour infusion of octreotide. When I had the surgery in 2019, I had stopped taking the octreotide, and they kind of gave me a little break after 15 years. And it was more, and then I decided to go back on it. I just broke my pump about 3 months ago, 4 months ago. So now I'm giving myself injections every 5 times a day. But I had severe syndrome. But the syndrome, the diarrhea and the flushing and stuff wasn't really a big problem, even though I was going 30 to 40 times a day. My biggest problem was histamine releases. I went to Dr. Waltering and I said, you know, I could go to the bathroom and I could have the flushing and the heart palpitations. He said, but the one thing I can't handle is getting itchy at night. And he said to me, I said to him, the doctors have given me every antihistamine on the market, and nothing worked. And he said to me, did anybody try Zantac? Zantac along with your antihistamine? And I said, no, it's kind of odd. Why? And he said, because you're having a histamine release, and a Zantac is an H2 blocker, and a Benadryl or Zyrtec is an H1 blocker. By taking both of them, it should stop. And so after 4 years, I was scratching so bad that I had black and blues up and down my arms, my legs, my belly. I actually got some relief. So for the last 23 years, the last 20 years, I've been taking both of those, and that really helped. And like I said, I can deal with the diarrhea, I can deal with the flushing, I can deal with that, but to get the itchiness and not actually breaking out in hives, but feel like kind of like the creepy crawlies going. So right now I am stable, and I do have some syndrome still, but the tumors aren't growing. So I'm very, very grateful. Considering I was given 5 years to live, and being here 23 years later is a miracle, and I'm very grateful for all the new medications and things like that to keep me alive. So, Bert, do you want to tell us a little bit about you?
Oh, it is on. Hi, I'm Bert. I am curious. Like, wait? What you said you were on a histamine 1 and a histamine 2? Does that make a histamine 3?
Yeah.
Sorry, I have a stupid sense of humor. I'm very childish. Okay, so my name is Bert. I was diagnosed about 1.5 years ago. I had a peanut with, so whatever it is, stage 4 peanut that spread to my liver too. I was grade 2. I also, hopefully I don't offend people with my humor, But as I like to joke, I obviously hit the cancer store on buy one, get one free day. So I do also have kidney cancer. So I have a second primary as well that has nothing to do with NETs. But I'm doing great. Like, honestly, I feel great. Like, my symptoms are fairly low. I've had surgery. I've done CAPTEM for a while. I focus a ton on my mental health. So I'm in therapy. I was doing yoga regularly. I haven't done it lately, but I meditate. I'm like, I think this came up this morning, but I'm very, very big into integrative oncology. So if anybody has any questions about that after or now, I'm happy to expand more on that. I think I would have, I mean, I don't think the doctor who said this is actually here, but I would have to disagree a little bit in that, like the stuff that I volunteer a ton of time, and I volunteer for an organization called Society for Integrative Oncology, which is all science-backed and evidence-based integrative therapies, things like acupuncture for pain or other modalities to help anxiety and depression in people with cancer. So I do a lot of volunteering for people like that. You know, I'm on the patient advisory board with NCAN. I have a couple of Facebook groups, blah, 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 blah. But I'm doing really, really well. I keep trying to challenge myself because I want to prove to myself what I'm capable of. And I keep trying to push myself a little further. So I've done things like go camping and hiking by myself, and I've taken long car rides by myself, and I do a lot of stuff like that. So I'm just very, very lucky. I understand how lucky I am. I'm in, from a treatment perspective, I did my 7 rounds of CAPTEM. Then I had a liver surgery in June where they removed a whole bunch of stuff. They also removed my gallbladder. They were supposed to get to the primary in my pancreas and my spleen, but I lost too much blood, so they had to stage me. I don't need to share this here to scare people, but if anybody wants to talk about risks of surgery, I'm happy to talk a little bit more about that afterwards. Or if somebody wants to ask, that's fine too. So I'm kind of like in this phase now where I am 6 months since liver surgery. I know I'm going to have a surgery on the primary and my spleen, but I keep being stable. I'm getting scanned every 3 months, and in my mind, it's like, if I'm stable, I'm not letting you cut me open. So, you know, when I turn less stable, then we'll worry about it. But again, overall, I feel great. I'm doing great. I'm not complaining a lot. I mean, again, I know cancer sucks for a lot of people. It's taught me a lot about myself. It's taught me a lot about the world, and I try to focus on a lot of that side of it. So,
if you had to give advice to a newly diagnosed or even a long-term person, what would you say to them? What kind of advice would you say about speaking to doctors, or how to be an advocate for yourself and for others?
I guess the first thing I would say is trust yourself more than anybody else, right? So I was, when I got diagnosed, I was in the hospital because I had internal bleeding and I had ulcers, a lot of the symptoms of a gastronoma, like Dr. Del Rivero talked about, but I hadn't been diagnosed with cancer. And I had I'll never forget this, I had a really bad upper endoscopy in the hospital, the kind where I almost died on the table. Like, I almost bled out, they had to intubate me, all this type of stuff. I was recovering a couple of days later, and I was coming in and out of brain fog, and the GI doctor came in, and that's when I learned I had cancer. And about a day after that, another GI doctor came in and said, "Oh, we want to do another upper endoscope on you to see how you're doing." And like, I looked at them and I said, "No." I said, "There's no way." I said, "You're doing another procedure on me that goes the same place as the last one where I almost died is going to cause more harm than good. So I'd rather wait for a while." And I think it's really, really important. We all know ourselves better than anybody else knows us. And, you know, even when we talk about drugs or treatments that we're on, there isn't any one thing that works for 100% of people. So you just have to trust yourself and work on developing that trust. I mean, I ask myself, no joke, I talk to myself all the time, but I literally will ask myself, is this a bad idea, a good idea? Should I eat this? Should I not eat this? Does this treatment sound right? Does it not sound right? So I think really, like, the learning yourself, asking yourself, meditation helps with some of that stuff too. I would really look at a lot of those things. Like, at the end of the day, like, you're the one who's mostly going to be in control of how you're doing, right? So if something doesn't sound right to you, don't do it because somebody else tells you to do it. Go talk to other people first.
Yeah, that's absolutely true. When I first got diagnosed, I went to see one of the specialists, and the first thing he said to me is, we need to put you on chemo. Now, remember when I got diagnosed in 2001, the only treatment was standard. And the doctor looked at me and he said, oh, okay, you know what? I think we should do interferon, or we should do DTIC, which is a very old chemotherapy. And I looked at him and I was like, no, I don't think so. And I went to a meeting and Dr. Waltering was there, and I said to him, what are your thoughts on DTIC and interferon? And he said to me, Dr. Kjell Oberg from Sweden's over there, I want you to go talk to him. And I walked over to him and he introduced me and I explained my story. I also have lupus and ITP, which I was diagnosed at 27 with. And so I have to be really careful of what drugs and choose when to do the right drug. And I explained this to Dr. Oberg and he looked at me and he said, no way will you go on that medication. And that was my thought and that was my oncologist's thought. But it was nice to hear a specialist say that. And he took my hand and he said, come here, we're gonna go take a walk. And he walked over to this doctor and he tapped him on the shoulder and he said, you see this woman? If you give her DTIC or you give her interferon, she's gonna be dead in 6 months. And the doctor stood up and said, well, you know, we can counteract it with this medication or that medication. And he was like, no. And I went back outside to Dr. Waltering, and I'll never forget this. And I said to him, Dr. Waltering, what is your feeling? And he said, what did Dr. Oberg say? And I said, I'm asking your opinion. And he said, this is what I'm going to tell you, honey. He said, put on your running shoes. He said, if Dr. Oberg said no, he said, you put on your running shoes and you run. And he said, and don't look back. He said, he's the #1 doctor. You don't look back. Just get those shoes on and go. And, you know, the whole time I was saying to myself, no, I don't want to do this. I don't want to give myself chemo. I don't want to give myself interferon. I'm going to set off my lupus. I'm going to set off my ITP, and I'm going to have more trouble than going to the bathroom and having flushing. So, and this was a #1 top specialist. And again, when I got diagnosed in 2001, there was 10 specialists in the world. In the world, not in the country, in the world. So, you know, you have to listen to your heart and know your body and know what you're feeling. And if something doesn't feel right, like I said before, you fire the doctor. So I think that that's really important to remember. Doctors are human, they do make mistakes. And if you feel really uncomfortable about something, then take another look. If you are saying to yourself, this doesn't sound right, take the time. It's your body. You choose what goes into your body, not the doctor. You get to choose. You have full control of your body.
One last really quick thought. Do not discount mental health. Mental health is so important. Like, again, we're all individuals, so I'll just speak for myself. If I didn't focus on my head and take walks and go to therapy, and I have a blog, so I write, and the writing is therapeutic. If I didn't do all that, I have no doubt I'd feel much sicker than I do. I think mental health is so under-discussed, especially for people dealing with cancer, and it's something people should really look at. Like, I mean, if you're not in therapy and you get diagnosed, or even if you have somebody who's diagnosed who you care about, I would go into therapy right away. These are all things that don't do any harm and can only help. So that's the other thing I would say. Mental health is critical.
I think definitely mental health. And you know, the caregivers, I want the caregivers to listen closely. You forget that you're so busy taking care of us patients, you forget that you need to take care of yourself. So all the men out there, go and get your prostate checked. All the women, go for your mammographies, go for your every test, your pap test. Don't forget to take care of yourself, because if you're not doing well, then the patient isn't going to do well. And so that is really important. And not only taking care of the test, but also think about your mental health as well. There is no shame in reaching out to a support group or going to see a therapist. It really does help. And I think that's really important. What do you think, Kat?
Yeah, I want to add to that a little bit, because I think that the caregiver takes the temperature, I always call it. We are taking the temperature of the entire situation, the entire family. And it's a lot on us to decide, because the people we love the most in the whole world are relying on us to take some of this burden off of them. And we take it all on, but we forget about our own burdens that come with the fears that come with a cancer diagnosis in your home. When my husband was diagnosed, my kids were 7 and 11. Fortunately, they got to spend time with their dad until their 20s. So it's great. But during that time, as a caregiver and trying to raise children and keep everybody above water and testing everybody's temperature all the time, it's a lot on you. And there are going to be times when you just can't hold it all up. You can't hold the roof up for everybody. So you have to set it down, and you need to take care of yourself. It's easier said than done, but there are smaller ways, like Bert mentioned, seeing a therapist or writing, journaling. But please take the time for yourself and keep educating yourself. I still come to these conferences because there's more to learn and there's more people to help. What you learn, share with others. There's something so powerful about that when you build a community. I call it my little table. We have a table of people that we have met over the years, and we hold one another up. When one of us can't handle it, somebody else can. And so please take care of yourself, but reach out. Don't feel any shame in saying, I have to put this down today and take care of myself.
Yeah.
And I hope that helps.
Yeah, sometimes it's just as easy as just going out for a short walk or taking a bath.
Yeah.
Especially towards the end of life, it's important that you get either a friend or family member to stay with your loved one and just go out and take care of yourself, because it is very, very stressful. Yeah. And as you can see on our sign, on our screen right now, it says, every family has a story and welcome to ours. Being here at this meeting, we are welcoming you into the NCAN family. Karen will tell you we've been friends for ever.
20 years.
20 years. And over 20 years. And, so we want you to feel like a family. You're not just a number to us, you're a person. We know what you're going through, and that's why when you call, a lot of places will only give you 10, 15 minutes when you call. If you need to talk to me for 2 hours, I will stay on that phone for 2 hours, because I want you to feel comfortable, and I want you to know that you are not alone in this journey. You have tons and tons of people that will stand behind you. There are specialists out there that work 24/7 for you guys, and Dr. Mary Maluccio, Dr. Aman, Dr. Heidi Del Rivera, there's some of the ones that are our top specialists, and they are there. They work 24/7. They are thinking about the next drug to come out. They're thinking about what they're going to do to help get you your test. They fight for the patient to get the drugs that they need. I mean, a lot of times the insurance companies turn it down, and a lot of oncologists will go, all right, well, they said you can't have it. When you go to a net specialist, they're like, I'm not taking no for an answer. I'm going to continue fighting to make sure that this patient gets what they need. And that's what we need. We need more people like that. And we're truly grateful for the doctors to dedicate themselves. This is not a very popular field to go into. There's not 10 million patients with this disease. So they don't make a lot of money, and they're not doing it for the money. These doctors actually do it for the love of the patients. They do it because they care about you. We care about you. You are not a number. You are part of this family, and will always be part of the family. Like I said, Karen's husband's gone 6 years. We still stay in touch. She knows that if anything happens, all she has to do is pick up the phone, and we're there for her. And it's the same thing. I can pick up the phone and say, hey, Carolyn, we need whatever. And she's like, okay, you got it. So just use the resources that you have here. Make sure you use the resources of all the sponsors here. Take the material home. You might not need it right now. You might say, oh, well, I don't need this test, or I don't need this drug right now. But if you take the material and you have it at home, you never know when you're going to need it. And then you're going to go, oh, I remember learning about that at NCAN's meeting. So take the material home and use it.
And if I don't know something and you ask me a question, I will make sure to find you somebody who does. And that's the beauty of the neuroendocrine community, that we work together and we are always networking to find the answers for you. So please don't hesitate to reach out to Marianne and Bob or Bert or myself. Anyone in this room, we'll find you the answer. You know, we will.
So does anybody have any questions? No questions? Wow.
Trisha, anything?
So we really appreciate you all coming today. We're gonna do the question and answers. So if you have any questions, please fill out the cards and we will pick them up. But when I say we are a family, I mean it. I'm not sitting up here and telling you that and then not answering the phone. We care. Everybody in this room cares for each other and we're there. So let's stick together. Let's spread the awareness. Let's educate these doctors. Let's educate people and let's find a way to get more treatments and get better outcomes. I want to, before I leave this earth, I want to see patients get diagnosed at stage 1, not stage 4. And that's my goal. Thank you.